infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, this past February, a consortium of 5 global health organizations reported over 1.3 million malaria cases during 2018 in Venezuela. This number is much higher than what was produced by the Venezuelan Ministry of Health and the Pan American Health Organization. Now these organizations are predicting the malaria situation will only get worse, forecasting 2.5 million malaria cases in Venezuela in 2020. So joining me now to talk about the malaria situation in Venezuela and these predictions is Leopoldo Villegas, MD. Dr. Villegas, welcome to the show, sir.
Good morning, and thank you so much for the invitation. It's a pleasure to be again with you guys.
Thank you, sir. Now, for the audience that may be unfamiliar with the history of malaria in Venezuela, can you share that story of the previous successes and what's happened in recent years?
Oh, absolutely. So malaria in Venezuela was basically the main public health problems. Early in the 1900s, malaria was basically killing part of the population, and the country had a negative growth. So meaning that there were more people dying for malaria than the number of babies born. And that's changed over time. There was a really good correlation and partnership with Rockefeller Foundation at that time. Over the years, in 1936, there was a malaria division that just basically took control and started using new drugs at that time. There was the chloroquine, they started using DDT, and there was a massive vertical program, kind of a military-style intervention, when the whole country basically started getting treatment and controlling the vectors, and also having some environmental changes to drain water and to trying to clean some of the areas when you have these breeding sites for mosquitoes. All these efforts were led by Dr. Gabaldon, a pioneer at that time. He led the World Health Organization malaria eradication program in the 50s. The leadership was so strong that the country managed to eliminate malaria in 70% of the whole territory. And this was basically the number one country in the World Health Organization list of countries that managed to eliminate malaria. And that's what the certification was done in 1961. And then the situation just changed. So basically we have a country, we have all the perfect conditions for malaria transmission around the country, except the capital, because the capital is a very high area in terms of around the mountains, and the conditions are not good for mosquitoes to breed and to reproduce. So basically we have the rest, basically all the country with the good conditions for malaria transmission.
Now, you forwarded me some charts, which I'm really basing this interview on, and it has some predictions and some numbers. But I just need to clear something up. On the chart, some of the data is labeled as civil society. Dr. Villegas, who is civil society?
That's an excellent question. Civil society is a group of organizations which are not related to the government. And in this group, we have the churches, we have the universities, we have groups that work locally, non-governmental organizations from any kind and any group, that they join forces together because malaria is affecting everyone. You know, when you have, particularly in this case, Venezuela, we have an epidemic. And when you have this kind of epidemics, everybody gets affected. Mosquitoes, they don't differentiate, whether you are a political party or whether you are for a specific group. So people get infected. And when you have so many, cases and death, this is something that as a society, people just have a concern. So when we mention here civil society, we mention here no government groups that are capturing information from the government and also from outside the government.
So like I said, and for the audience, I will publish these charts on the website. There's charts that show a very drastic difference between the increase in cases from 2000 to 2018 between the Ministry of Health and civil society. About a double, it's about a double difference. Dr. Villegas, what is your group counting that the Ministry of Health is not?
Fascinating. Thank you for this question. The Ministry of Health is not reporting all malaria cases, although they are recording the information of what is not reported. So let's make things clear. What the Ministry of Health in Venezuela is reporting is what they call it new cases. Okay, but also there is a separate reporting system for patients that are arriving to the health facility that got malaria in the last 30 days. If you got malaria in the last 30 days, then you go into a separate reporting system that this is not the official numbers. And this is the difference here. So we have new cases, that this is the official reporting by the Ministry of Health. And that's what the Ministry of Health, or as the government of Venezuela, report to the World Health Organization. But then there is another group which is increasing over time. And then why is increasing over time? Because the country is having several stock out of medicines. And when you're having a stock out, you basically are not either completing the treatment or you are not fully treated. And that basically makes you to return to the health facility with malaria again that might be the same infections or might be a new one because there's an epidemic situation. So you might get, bitten several times with mosquitoes again. Mm-hmm. And this difference sometimes even reach, the group that is not reported sometimes is just bigger than the official number of cases. So when you start adding up the new cases plus what is not reported, but is recorded there. And then there is two other groups that we estimate, which is the people that are not going anymore to the health facilities, and they treat themselves. And then there is what we call underreporting, which is what is not recording into the official Ministry of Health. So when you start adding all those numbers, that's what it gives you a picture of how many cases are estimated. What are the implications? And I think that's the most important point here for information. The implications are, if I report only the new cases, my forecasting of supplies, treatment, will be missing a big chunk of the malaria cases, and that will lead to a stock out of medicines and supplies for diagnosis. And that's the reason that we just join all forces to showing the reality. The recommendation by the World Health Organization is that every single case of malaria that is diagnosed and treated should be reported in any national malaria control program at any country. And that is not being followed in Venezuela right now.
Gotcha. Well, of the three charts you sent me, the most eye-opening chart was the one where civil society predicts 2.5 million malaria cases in 2020. This is a prediction, of course. And these are huge Africa-like numbers, much higher than Venezuela or UN predictions. Dr. Villegas, can you talk about that?
Oh, absolutely. And I think that here what is not really eye-opening. It's just basically a huge epidemic. What we're having here is the biggest epidemic in the whole Americas continent happening right now with very little attention. So we have, I haven't sent you the mortality data, but the number of deaths is also increasing. And this year in December, we're going to have the annual malaria report saying again that this is the country with the highest. But we don't want to hear that this is the highest, numbers of the biggest numbers in the continent. What we wanted to hear is actions. So we're talking here about 2.5 million estimations. Between 2018 and 2019, which is very few months, the whole internal migration, there's a whole complex humanitarian emergency happening in the country. So people are basically hungry. So people just move and go into the mining areas and they start digging to trying to get some gold and trying to survive, buying some food to give it to their families. And when they do that, they move from several different states from the country and they move to the south. When they return to their houses, they just bring malaria. And as I mentioned before, the whole country have the perfect condition for transmission. So those areas that were malaria-free for so many years, now they're getting infected. Now they're having local transmission, and now really there's several, micro epidemics happening in different states. So we have right now the latest number in 2019 that we hear from the ground is that there are 22 out of the 24 federal entities with local transmission. So that means that what we have here is a growing epidemic. But the epidemic is not only from the normal malaria foci that we used to be. Now it's just a problem that is spread all over the country. And when we have this kind of epidemics, then we expect to have a higher number of deaths, because that means, and those epidemics, pregnant women and children are the first ones who are going to be getting malaria, and they are the first ones who die in this kind of epidemics.
Yeah, now, and this can't be looked at in a vacuum. I mean, this has to be affecting Venezuela's neighbors too. Dr. Villegas, what are you hearing from Brazil and Colombia and some of the other neighbors? Anything?
Oh, absolutely, yes. We're following very close this epidemic with the neighbors, so we get information from the National Health Information System from the countries. So, for example, in 2018, Colombia have 1,684 cases that were imported from Venezuela, and they have a weekly report and everything, and we know where the cases are being imported, diagnosed, and treated in the Colombian side. Brazil is the country that is most affected because it's the one closest to the biggest epicenter of malaria from Venezuela, which is in the south, and Brazil is reporting 4,600, a little bit more than 4,600 cases. But then we have malaria cases in Ecuador, 23 cases, 22 in Peru, 3 in Chile, 10 in Argentina, 32 in Trinidad and Tobago, and then we have also a few thousands in Guyana, which is in the border with the epicenter of malaria in Venezuela, and then we have even cases in Suriname. So this is a whole spread. This is a spillover of the epidemic. Probably what I forgot to mention here is that there are already 4 million Venezuelans that left the country because the conditions are so terrible that just prefer to leave the country working, days just to trying to find a place where they can have a life and they can eat. I think more importantly, to find a job and help the people that is left back home.
Yeah, and malaria is not the only infectious disease epidemic that the country is dealing with. But Dr. Villegas, is there anything being done to try to get this malaria epidemic under control from within the country?
Yes, I think the Ministry of Health is trying to at least maintain the basics, but this is no business as usual. I'm trying to, we have a contact with the authorities, with local groups, and my message usually is, this is an epidemic. If you don't manage this malaria epidemic as an epidemic, you won't control the cases. And this is what is happening. So maintaining the diagnosis and treatment, this is the first step. I think that is being covered. But you need to go further to control the epidemic because the spread now is in the whole country. So what they need right now is just to have a massive investment in cost-effective intervention in order to control. What that means, cost-effective intervention, you need to provide insecticide-treated net. So it's a mosquito net that have the insecticides in the fiber, and that protects people of getting bitten by mosquitoes. Also having medicines all around the country. It's not only in the previous malaria no areas, now it's having treatment in every single in federal entity, and also kits for management of severe malaria, because what you're trying to do right now is trying to prevent that. In order to do that, you will need to have a massive investment, and this is what is the main challenge right now. Today, for example, the Global Fund to fight AIDS, tuberculosis, and malaria is having a meeting in Geneva, and for first time they are activating a specific article for making a country that is not eligible for funding to be able to receive funding for malaria, because the resurgence of malaria in Venezuela is unique. It's one of the highest in the world compared with year 2000, and that will make the country to receive some funding. But here we're talking about, mid-2020 or the end of 2020. So in the meantime, I think the urgency is right now. And this is what we working with several organizations. We're trying to push the magnitude and trying to alert people that if there is nothing, if you do not control the epidemic, you will start receiving, increasing the number of deaths and receiving more people dying at the health facilities and hospitals in the country.
Dr. Villegas, what is the primary strain of malaria down there? Is it Plasmodium falciparum or Plasmodium vivax?
Well, actually, we have 3 parasites in the country. So we have Plasmodium falciparum, vivax, and Plasmodium malariae, which is very rare, and particularly in the South, Bolivar and Amazonas state. Plasmodium vivax is responsible for around 70 to 75% of the malaria cases. So, and what is the difference here is that the Plasmodium vivax, they have a particularly interesting parasite, because when you treat Plasmodium vivax keep a parasite form in your liver. And in order to get rid of this parasite form, you need to get 14 days treatment with a drug called Primaquine. And that's fine, but the adherence to 14 days treatment with a drug with side effects, sometimes you get itching, sometimes you just can't sleep. So people basically stop completing the treatment. And then that makes you come back again with another episode. And this is what we call the recurrence. So there is it might be probably the same infection, and the people are coming back. When you have 75% of those cases in the country, you end up with a big chunk of those cases that are relapses or recurrences of vivax, that they are coming over and over because the adherence to the treatment is really poor. And this is very, very well known in every national malaria control program around the globe.
Okay, well, let me just ask you one final thing. Any final thoughts on Venezuela, malaria, or any related topic?
Oh, absolutely. This is I think that the concept here is malaria epidemic is not happening alone. As you mentioned before, there are several epidemics ongoing in the country. So this is what we call a syndemic. So we have 2 or more epidemics affecting the population, and synergistically they are basically increasing the suffering of the population. So we have measles epidemics, we have diphtheria, we have malaria, we have pertussis of whooping cough, and then we also have diarrhea, hepatitis, and a part of that then we have the HIV and tuberculosis going on. So the situations are really a complex humanitarian emergency. We don't see the humanitarian emergency response going on. The response is not aligned with the magnitude of the problem, and the speed of the response is also far away of what the country needs. So I think that we're going to see a lot of definitely we're going to see a lot of death. The information is being criminalized. If you report death in the country, you are in trouble and you might have some militaries visiting you. But when you have this kind of situation where so many people die, it's just basically impossible to try to cover the sun with your thumb. So we will see an increase of mortality, and that's what we need to prevent.
Now, is the humanitarian aid just not available, or is the Maduro government not allowing it to come in?
Well, what we get from the ground is a different opinion. So we're supposed to receive humanitarian aid, but the humanitarian aid can cover probably less than 1% of the need. And this is based on a 7 million people in need estimation by the UN system. We have an independent group that they just estimate by the end of 2018 that there were 50 million people in need. And all that is without taking into consideration the hyperinflation in 2019, and also all the shortage of water and electricity that is happening in the country. So the situation is really, really an emergency. And, when you have 4 million people that left the country, and the estimations are that 8 million will leave the country by 2020, this is something that is bigger even than Syria. So at this level of the situation, you expect it to have a stronger, what we call humanitarian assistance. And that is not happening yet at the country, and we don't know really the reason for that.
Well, what a horrible and sad story. I want to thank you, Dr. Leopoldo Villegas, for sharing this information and talking to me about it today. I appreciate it.
Well, thank you so much. It's a pleasure to share with you and the audience.